you can become anything and everything as far as you set your heart to be.
Okay.
You can.
For our viewers actually listening to this, they would like to know like what will they gain after listening?
There are a lot of people like me out there that just need a voice, just need an encouragement. They just need to hear something and they'll be good to go. So there's really no difference being a volunteer and an advocate. The thing now is that it's kind of like a volunteer is more like a soft kind of person under advocacy. Under advocacy. But there are these small hospitals in the quarter.
Yes.
My teacher always said that you see somebody having drugs in a career. I don't know how.
I'm telling you.
But then you see that there are people that ethically, I don't think it's correct because
what I want now is like to speak directly to the girl. That was that also want to like follow you because you have shared a lot of stuff that I'm sure that will be inspired by you. That I want to be like you. I have to be like confident. So, what is, let me say, can you give one thing that I can give to this female social youth today that can help them, inspire them, or let me say, even motivate them towards the direction of medicine and MLS?
Hello, thanks for tuning in again into this video. It means the world to my team and I, and we are so glad to see that you showed up for this video and you are going to get inspired. We just have one request for you. Please subscribe. By subscribing, you help I and my team be able to produce these amazing and inspirational videos for you every week. We will bring the best guests on our podcast to inspire you and motivate you towards your journey of success. So all what we want from you is to subscribe. Thanks.
Hello, Confidence.
Hello, Manfred.
Yes, how have you been since morning?
I'm good, and you?
Everything good. And thanks once more for accepting our invitation.
It's my pleasure.
Okay. So I'll just go directly to the question. If I was to ask people around you, that's who is Ako Confidence, what would they say?
All right. A lot of people say I'm confident, which I know I am.
Yeah,
So that's me. Yeah.
Okay, confidence.
Yeah.
Okay, I like it. Means that you'll be giving some confidence to do this podcast.
I hope I will.
Okay. Then for our viewers actually listening to this, they would like to know like what will they gain after listening to you?
All right. Okay. I'm hoping that after this interview, I'll be able to inspire a lot of people because I know that there are a lot of people like me out there that just need a voice, just need an encouragement. They just need to hear something and they'll be good to go. So I'm trusting that after this interview, I'll be able to inspire a lot of people like my kind.
Yeah. Actually, I myself am hoping to be inspired from you.
I hope.
Yes.
Yeah.
And I know you're actually studying as a medical laboratory scientist.
Yeah.
Yes. And I want to ask you, what made you discover this your passion?
Okay, that question is a bit tough because I won't say I discovered medical laboratory science per se. I just saw myself doing medical laboratory science.
Yeah.
And when I say I saw myself doing medical laboratory science is because what I had as passion was medicine. And you know, everything growing up, I want to be a medical doctor, I want to be an engineer. You hardly hear someone saying, I want to be a nurse, I want to be a medical laboratory scientist, and that was me. But then I wrote the medicine concours, I didn't make it, and I had to resolve to settling for medical laboratory science. In my first year, I didn't like it. And so I don't say I found passion in medical laboratory science, but as of now, I feel that I'm in the right profession. So, yes.
Let me just ask you, like you said at the beginning, you were not interested into medical laboratory science, but now you have found like an interest into it.
Yeah.
How did you transition from that, let me say, from that position of not liking it to having an interest in it?
Okay. I won't say I can't really pinpoint the thin line, the in between.
Yeah.
But I just know that in my first year in medical laboratory science,
Yes.
I had zero interest in the department. I wasn't doing bad, but I felt that I would have done more if I gave in interest. And so when I actually accepted the fact that I am into this thing and there's nothing I can do about it.
Yes.
And the only thing is that I should work hard. I should do something that will actually be productive for myself and the community, because at the end of the day, health is for the community at large.
That's true.
And so I just found passion, and the passion is actually what I'm doing presently, working with the community. I'm not the laboratory room kind of person, but I believe that I can actually create more impact in health with the community, which is public health.
Okay.
Yeah.
Yeah, from like one key phrase that I got from what you were saying, like even if you're in a field that you don't like what you're doing, try to find something out of it that you like doing,
Yeah.
and associate it to it.
Yeah.
Like you love being with the community, interacting with the community.
Yeah.
So you find a way to take this your community love into the medical laboratory science.
Yeah.
Yeah, that's something quite cool. And many people are listening to you right now, like let me say that 17, 18, 19, and even maybe 21.
Yeah.
And they're like, I want to write this concours, but I don't know which concours I should write. So let me just reframe it and say, let's speak to the 18 years you that's about to write the concours.
Yeah.
If you were to advise her, what would you have said?
Okay. My story is quite challenging. It's a bit kind of off. Yeah, but if I would like to advise you who is watching, I would say that the very first thing before you go into that exam hall, you should be very sure of what you actually want for yourself. I mean, we've grown up where parents tell you what to do.
That's true.
They start calling you a medical doctor when you're in lower seats,
Yeah,
you're in
very
form
true,
5, and you just develop that attitude in you that I want to be a medical doctor. And so you become so, can I say, short-sighted that you don't see beyond that medical doctor. And that's why some of us will have heartbreaks. Yeah, we've had heartbreaks from concours. Yes, because you didn't get it, you feel that that's all to life. But I feel that anybody that is watching me, you should think out of the box. Yeah, the very first thing is that you should be sure of what you want. If it's medicine, fine and good. You work hard for it, because medicine doesn't just fall from the sky. They actually work to get that concours, to get into med school, and then study for 7 years. So you should prepare yourself, prepare your mind, and prepare everything about you. And then the second thing too is that you seek advice from people that are already in the field. When I say already in the field, you can have mentors, you can have seniors that are already doctors, some of them are already in med school. Those people can serve as an inspiration for you to actually get into what you're doing. Now, aside medicine, medical laboratory science, we have nursing, we have other paramedic departments that you can actually look into. The thing is that most of us, we are not actually searching deeper. We are just at the surface. Yes, I want to be a medical doctor. Yes, I want to be an engineer. But what if? That's a big question that we are not always answering. So let's keep it in our mind that what if, and we answer those questions sincerely to ourselves. And if you feel that it's still what you want, I believe that the people that have written the exams for 4 years, some 5 years that I know, and they made it, and so you can still make it. So the only thing is that you should be sure of what you want, and then you should go for it.
Yeah. I love. Let me like take out the two key phrases that I said. If you know what you want, seek advice from those who are already in the field. They can help you orientate you towards that field.
Yeah. When I say seek advice, I mean, like, you see that there's so many people that get into med school here, and then yes, they pass the concours, but they are not actually maximizing that opportunity. It's not easy getting into med school. I'm talking about med school because it's kind of like a normal thing for us in Cameroon. It's a prestigious concours, and when you get into it, it's something that, in fact, you have to go and greet your village people that have given you the chance to actually, yeah, yes. But then there are medical doctors that I feel that they are some of them. I'm not saying all. They feel more lost after even they are having the certificate, because they didn't maximize the time they were in med school. You see that as a medic, attend health campaigns, attend workshops. In fact, you have a lot to actually give into that profession. But when you come out, sometimes I feel like you went through med school, but med school did not go through. And it's as a result of that, you actually got into the school without seeking mentorship, without even knowing the reason why you even went into that field. And so sometimes you just come out as dry as you went into the profession.
That shows it's important to have a mentor.
Yeah, so when you seek mentorship, you get advice from people, you'll be able to maximize that opportunity than anybody that has been there.
Okay.
Yeah.
Now I've just been like how to enter in that university. Let's go now particularly to your field. That's MLS, medical laboratory sciences.
Yeah.
So firstly, the viewers that are watching, they don't really know what it is. Yeah, some may know but not really know what it's all about. So I want you to tell us, who is a medical laboratory scientist?
Okay. A medical laboratory scientist is a healthcare professional that has been licensed to actually practice. Now, what do? They do testing of specimens in the lab. I'm just saying in a layman's way, and then
Yes.
interpret results. And this result interpretation is for the physician, which is the doctor's use. He uses it to do diagnosis. Now, we always have this phrase that will say that without a medical laboratory scientist, your
Yes.
doctor is actually guessing, which is correct.
That's
Because
without a medical laboratory scientist, your doctor is guessing.
yes, your
Why?
doctor is guessing. I mean, 70% of the diagnoses that are being made by doctors comes from the lab, results from the lab. A doctor you might come to a doctor's office that I have a headache, I'm having fever. They might say, okay, it can be malaria,
Yes.
it can be a flu, it can be anything. I mean, anything can come up from a headache, but then they are just assuming.
Yes.
It is a laboratory test that will actually determine if this person actually had malaria,
Yes.
or he had fever, or he had any other thing.
Okay.
Yes, so yes, that's just basically what medical laboratory science is all about.
Okay. Okay.
Yeah.
For us to understand more, let's just try to take a scenario. Yeah, where let's say someone having headache or any other sickness goes to the hospital, because you know we that are always sick, we're always used to be with the doctor. We don't really know who are these medical laboratory scientists. So let's take a scenario where the medical laboratory scientists will be in place. So let me say I'm sick, I have headache, I go to the doctor. Let me say to the hospital, I meet the doctor.
Yeah.
What next? How will the medical laboratory scientists come in play?
Okay. The very first thing you get in the hospital is that you get to the reception. I mean, they welcome you.
Yes.
And you key in your information, and then they direct you to they actually say you do consultation, right?
Yes.
I mean that you meet the doctor in for that day, the person that is on sick. Now you table your problem to the doctor. It is basically diagnosis. I mean, he actually, you tell him your symptoms,
Yes.
what you're actually feeling. If you're having headache, if you're having waist pain, if you're having back pain and all of that, you tell the doctor. Now he is a professional.
Yes.
He's actually looking at it in this case, in this scenario. It's either if this person is feeling this way, he might be suffering from this, or he might be suffering from this. It can be as a result of this, or this has caused this to be this. It's just like
The assumptions that you're
yes,
saying.
we don't want to say guesswork because it's kind of like belittling that profession.
Yes.
But then at the end of the day, it's something like that.
Okay.
Now, the right test that correlates with those symptoms that you've actually given. And that's why it's advisable for patients or people that get to the hospital that when you get to the hospital, you tell the doctor what you're actually feeling.
Okay.
Because it is from that, from what the patient tells the doctor that he actually prescribes or he gives his diagnosis. Now it's being taken to the lab.
Yeah.
It is from the lab there that they test for those tests that the doctor has requested. It is in the lab that we do the testing, we interpret the results, because the doctor does not know about bacteria, he doesn't know about parasites, he doesn't know about anything in the lab. Even though I think they have basic knowledge, but then we are the professionals, it's our field. And so we do the testing and then we interpret the results. From there, the doctor can pick up. He can now know what is actually wrong with the patient.
Okay.
Yes, so that's just it. So the hospital is kind of like a network. Yes, you can't move from one place and you skip the other.
Okay.
Yes, it's a network. Somebody must do something that will encourage the other person to do another thing, and it goes like that. It goes like that.
Okay, I see, I see.
Yeah.
That's when I go to the hospital, the doctor, his host is just like to take the information from me, what I'm sick all about. Then I think he'll give the data to the medical laboratory scientist. He'll be the one now to analyze the data and see.
And then it goes back to the doctor.
Yeah, and then it goes back to the doctor.
Yes.
I think the feedback that goes back to the doctor.
Yes.
That person is exactly sick from this, that. And what about medicine? Because when I hear laboratory, I think also about like medicine, application of medicine, all that. People also do that.
Like issuing of medicine and all of that.
Let me say, they discovered a sickness that's mosquitoes biting somebody, then comes to malaria. Then we need actually an antidote to that. then somebody in the laboratory discovers paracetamol. Do people like come like form those medicines, build them up?
Okay. The good thing about the healthcare profession is that
Mm-hmm.
we know almost a bit of everything.
Mm.
Yes, like for me, I studied pharmacology in my department. Even
Yes.
though it's just a scratch surface kind of work,
Yes.
but then I think in the quarter I can be able to. It's not in my place to prescribe,
Okay.
but then if it's an emergency, I will know what to do. Like this person can take this for this, this
Mm-hmm.
person can take. That's why I say we know a bit of almost everything.
Mm-hmm.
But then everybody is a professional in his or her own field. Now, when you talk about drugs, we will now be looking at the pharmacy.
Yes.
A pharmacist, that's a doctor, but
Okay.
he's a pharmacist.
The pharmacy.
And so yes, they do more of the drugs
Okay,
dispensation,
I
all of
get.
that. But then there are people that specialize in drug formulation
Mm-hmm.
and all of that, the
Okay.
chemistry and all of that. But I think it's more of a pharmacy kind of a thing. But then we all know a bit of everything. That's why I can tell you about something about drugs. You can give this one, we say this is topical, this one is suppository, this one is this. It's just what it's all
Okay, I
about.
understand. I understand. That's medical laboratory scientists. They deal more in interpreting what the patient sees.
Yes.
Okay.
Yeah.
So, from what you have just even explained, I've understood that medical laboratory scientists are actually key people in hospitals. Yeah.
Everybody, I don't want to be stoned.
Mm-hmm.
Actually,
Yeah.
everybody has a role to play in the hospital.
Everybody has a plan.
Yeah, you cannot say that a medical doctor is much more important than a nurse.
But let's say without the medical, that's laboratory scientists, can the hospital see one?
Okay, there are these small hospitals in the quarter.
Yes.
My teacher always said that you see somebody having drugs in the area. I don't know how,
I'm telling you.
but then you see
Funny.
that there are people that ethically,
Mm-hmm.
I don't think it's correct, because
That's true.
like how you be giving out diagnosis without lab results. There are some basic lab tests that anybody can do, even you
Yes.
as a tech person you can do.
Okay.
Yes, you can just come to the lab, you prick somebody's hand. When I say prick, you choke somebody's hand,
Yeah.
and then the blood you mix, and then you are doing MP. But then viewing it under the microscope is not your domain, and so you might never even see a parasite under the microscope, right? And so what I'm saying is that ethically, I don't feel that a doctor can work without a lab scientist, nor
Yes.
a nurse. You get right? And that's why I said it's more like a network. It's kind of like feedback mechanism. I send you information, you
Yes.
bring back results.
Okay.
There should be, that's why they say information will only be information when you have feedback, you get back results.
Exactly.
Same as you can't consult a patient, you don't give them the results. The patient will go back still feeling unwell, even though you've treated them and
Yes.
all of that and stuff. And so they work hand in hand. And that's why in the hospital you will find that there's the laboratory unit, there's a nursing unit, there's an office for the doctor,
Yeah.
and all of that. There should be something, even if it's a small unit, a small hospital, you see that at least there is something, even if it's not sophisticated, but then there should be something to work with.
Okay.
Yeah.
I see. But let's say in Cameroon here, many people usually go in for being a doctor or a medical doctor. Why don't the majority go in for medical laboratory scientists when in each hospital they must be there and we actually need them?
Okay. You know that in every story there are unsung heroes.
Yeah.
I mean, like there are people
It's
that
true.
do
It's
the
true.
work, but yeah, So medical laboratory science is a field that hasn't been exploited to some extent. I mean, medicine is so prestigious
Yes.
in Cameroon that every other health profession, every other thing department has to wait. Yes. And so you see that most of the people you find doing medical laboratory science or nursing, can I say there are people that had a plan B, plan C, others I don't know which plan they had. And so you see that most of the people that you find in these departments, they didn't want to be there. It's just because of frustration. I said most, not all, because there are actually some people that wanted to become there.
Yes.
And one of those people that found themselves doing MLS when they actually did not want to. But then the difference with you who found yourself there but didn't want to, and someone that actually found themselves there, or they still don't want to be there is because it's you that maximize that opportunity. Because if you find yourself in that field, you don't like it here, but then you find something for yourself and you do it, you see that you start loving the profession. And so most of the times people go into medicine because they have not found reason to being into MLS. They feel that it is the least paid job.
Yes.
Being a medical laboratory scientist, it is the less prestigious kind of thing. I mean, like wearing a coat, a doctor is bossing you around.
Yeah.
I mean, it's not something, it's a nightmare, right?
Yeah.
But
True.
then I feel that if you find it as a calling, you actually maximize the opportunity, you go for it. The only difference with a medical laboratory scientist and another medical laboratory scientist is one who has found pleasure in doing it,
Yeah.
somebody who has found purpose in doing it, and is actually doing it.
Okay. I have this question. Is MLS known to the public? Like when somebody is going into the medicine concours, do they know about LMS?
Okay,
Or it's when they get in, then they introduce them to all the different fields,
like when they get into
the school, or let me say the university. Is it when they're introduced to it, or when they're writing the concours, they know that they're going directly into it?
okay, no, like before you even sit for the exam, you already know what you're writing.
Oh,
It's
okay.
either medicine for like the Faculty of Health Sciences, University of Bamenda.
Yes.
When you're getting into to write, when I wrote the MLS exam, we write one exams both for nursing and MLS. But then it's the same exam but different departments,
Okay.
depending on your choice. Now they have a way of determining which one is which. Like they have a subject, I don't know if it's chemistry for nursing or it's biology for nursing, but they have a subject actually, it's more of like it has the highest points in determining your success and all of that.
Okay.
Yes, but then before you sit for the exam, you're actually sitting in for
Yeah.
MLS or nursing.
Okay. I
Or
get.
if you're sitting in for medicine, you're sitting for medicine exam. So that's it. They all have different exams and then different programs, how they run the exams and all of that.
Okay. I see. I see. I see. And I know that you're someone that have been an advocate for many different things,
Yeah.
from the SDG 3 to the SDG 4 and other organizations. So I want to know, like, what does it mean to be an advocate as an MLS?
Okay.
And what do people do actually? Yeah.
Okay. My advocacy work is not, if you check clearly, my advocacy work is not really MLS inclined. Like it's not solely on MLS, and
Yes.
that's why you see that I'm an advocate for Sustainable Development Goal 3 and an advocate for Sustainable Development Goal 4.
Yes.
Now, Sustainable Development Goal 3 is just good health and well-being,
Yeah.
and so you see that it's MLS, there's medicine, there is nursing. In fact, it's just health. So I'm an advocate for good health. And now it's more tilted towards the public health domain because I mostly function in the community. And so, and that's why I said I found purpose in MLS.
Yes.
Because I don't want to be that kind of person that I'm just enclosed in a room doing tests and all of that. But then, like getting to the community, getting their problems, solving their problems is kind of
Yes.
the real deal for me.
Okay.
And so that's basically advocacy for me. It's not just MLS inclined, but then there are challenges, of course, because I deal most with medics, like the medical doctors,
Yeah.
medical students, and at some point they ask me, "Is this one a medicine student or this one?" It's kind of like I'm a different kind of a medical laboratory science student,
Yeah.
and so it's a call for consent for my course mates. But
Yeah.
I really don't care at some point because in the first place I love medicine, and so it's kind of an avenue for me doing something in a different way that I
Yeah.
love. Yes, so
Okay,
that's
let
the
me just ask this
advocacy.
question. When I say I am an advocate, what does it mean?
When they say you're an advocate, it's deeper. If you tell me that you're a volunteer, I can look at you that okay, you're a volunteer, yes. But when you say you're an advocate,
Yes.
advocacy will cost you a lot. I mean, it
Like
will
what?
cost you your money.
Oh.
It's always the scenario. It will cost you your money.
Yes.
It will cost you your energy. It will cost you your time. It will cost you resources.
Yeah.
Resources is necessarily not just money. And so when they say you're an advocate, you're giving your all into a particular cause.
Yes.
I say I advocate for health. Let me use myself as an example.
Yes.
For this, the past for the past weeks. I've
Mm-hmm.
been to Buddha, I've been to Chang,
Oh.
I'm presently in Yaoundé,
Mm-hmm.
I've been to so many other places, and that's because I'm advocating for health. I want to
Yes.
learn everything and anything just to
Mm.
be better at what I'm doing,
Okay,
which is advocacy. And so that's advocacy
I
for me.
see. Then I know that you have been an advocate and you have been a volunteer.
Yeah.
So, like, if I was to look you doing the advocacy and look at you doing the volunteer, what would be the difference?
I am both, I would say. There's
Mm.
really no difference being a volunteer and an advocate. The thing now is that it's kind of like a volunteer is more like a soft kind of person
Yes.
under advocacy. But
Mm-hmm.
then I think there's really no difference. It's just maybe words, it's just
Mm-hmm.
maybe the gravity about it. But like I would say, when you call yourself an advocate, it demands a lot from you.
Mm.
It demands so much from you. Same
Yes.
as volunteers. The volunteers don't just fall from the sky.
Yes.
It's a decision that you make on a daily basis. You feel hurt while in the process.
Mm.
You feel um, excited sometimes when you see results.
Yes.
But then it's the ups and downs that comes with advocacy and volunteerism.
Oh, okay.
Yeah.
Now, let me just take you to kind of a tech perspective.
Okay. Tech.
Currently, what is emerging and kind of making people wow is AI.
Mm-hmm.
Many people are like AI doing this, AI doing that, AI even replacing the jobs of software developers.
Yeah.
And in the future, we don't know, it may replace a lot of jobs. So for the MLS job, do you think an AI can replace a job?
Tough one. Okay, I attended a conference months back and they said AI came to replace jobs here,
Exactly.
but it is creating more jobs.
Yeah.
It's creating more jobs than the jobs it's replacing. And so the only thing is for you to align with the innovation, the change.
Mm.
Because the only difference, the people that will cry at the end of the day, there are people that they didn't upskill, like they
Very
didn't
true.
live up to the expectations of the AI era.
Yeah, that's true.
Because people are changing and everything is changing. It's not just about AI. Things
Mm.
are changing. There are a lot of innovations. And so
Yeah.
the only thing is for you to align yourself, to place yourself for that change.
Mm.
And so that's why you see that, okay, in the lab, let me use for the example you've given me. In the
Yes.
lab, there is a lot of automation.
Mm-hmm.
Machines that we're doing manually,
Mm.
now it's automated.
Yeah.
But then it is still humans that will input that information that has been, is it AI generated or whatever.
Mm.
And so at some point, I won't say AI will replace MLS jobs,
Yes.
but it will replace those that do not align themselves to actually flow with the innovation that is going on at this point. And so
Yes.
left to us is that we should innovate
Mm-hmm.
ourselves. We should upskill. We should gain those skills. When they say learn, I don't know about tech. They say
Mm-hmm.
is learn what um is it coding?
Yes, coding, exactly.
But then that's no more of AI.
Mm.
But then when they say you should upskill, you should integrate yourself, you should learn those skills. Basic skills, I mean, like there are people that cannot save themselves with just basic IT skills.
Mm-hmm.
And so it is just okay that when everything is changing, you should also place yourself to that change.
Okay.
Because if you sit back and wait,
Mm-hmm.
no one cares. I mean, the world doesn't care.
Mm-hmm.
Like they'll tell you that the world doesn't revolve around you.
Yes.
It's just the same scenario as this. And so let's just place ourselves for the change. I think,
Okay.
yeah,
Yeah, I also love taking real life examples.
yeah.
So I'm not really accurate. Let's say when do they pierce somebody's hand to take the blood and test? Is when the person is sick of it.
Uh, we pierce hands, like we prick a lot of
Almost for
hands for,
everything.
not almost for everything, but there's some things like they'll collect your blood
Mm.
using your vein if they need so much blood.
Yeah, just
But
give
if
me
it's a
like an
test,
example for a
malaria
test.
test,
Malaria, okay.
yes.
So let's say I pierce your hand for malaria, I give it to you, the MLS scientist. You analyze it, figure out, I don't know how you guys you figure out there is malaria. So will you be able now to like just place your hand, put in the machine, and AI just analyze, let me say AI mixed with robotics. That's a machine that can think by itself, analyze all of it together, and just give back the feedback to the doctor. This person is suffering from malaria. Will it be possible?
Mm, I think there should be, I think in the years ahead, there should
Mm.
be something like that.
Yeah.
I mean, the world is changing. I mean, technology is so advancing that there are so many things I mean, you see robots on the streets moving as humans, and so I
That's
think
true.
to some extent anything can be possible.
Yes.
Yeah, something like that. Yeah, but then for now you can talk about AI or automation. Let me use automation
Yeah,
in
that's
the
a nice word.
laboratory. Yeah, in the laboratory, you can talk about automation in this. For example, you're doing full blood count, which is a test that is being run. It's kind of like a test that it determines so many parameters that the doctor might request. Maybe they want to check your white blood cells count. They want to check your this thing. They want to check your white blood cells. They want to check your red blood cells. All of those platelets and all of that. You see that um you just have to collect the patient's blood. You run it through a centrifuge. Sorry, for full blood count, you don't run it through a centrifuge. But
Yeah.
there are a lot of processes that you undergo, and then you pass it through the full blood count machine, right?
Yes.
It's kind of like it just picks up the blood and then runs it through the machine, and then it gives you a whole lot of parameters of those that you would have wasted so much time into checking for one. For example, white blood cell counting. Now you have to count. It's actually a machine. You place it under a microscope. You do all the analysis. You place it
Yeah.
under the microscope, and you're tapping the machine. It's like 1, 2, 3. That's how they say counting.
Oh,
You're
okay.
actually counting the number until you get the number of parasites under the slide. So you see that the full blood count machine has come to fasten the process,
Okay.
and that's automation that will actually embrace, because it saves a lot of time and it saves so much. This, in fact, you hardly lost patients because it saves time and all of that. So
Okay.
that's automation, the advantage about it. So that's an example.
And while you were just speaking, this came to my mind because, as I told you, I also interviewed someone in the medical field.
Yeah.
So he's someone that is at FMBS and he's both an entrepreneur in the medical field. So he was talking to me about this app that I figured out that is something of amazing. So it functions in a way. It's called My Health Tech.
Okay.
So it's an app that works with smartwatch. So you just wear your smartwatch, then you can measure. I don't really know a lot of details. Let's say
Your
how
heart
your
rate, your
heart
blood
rate,
pressure.
a lot of stuff. And then with that, he told me that using what you measure and the app that has an AI, a patient, let's say a patient just having the watch and the app could predict what he's sick of. Yeah. And then easily just go to the hospital and just buy the drugs. So I want to know your own perspective about that. Like, if more solutions come related to that, how will this MLS, these doctors that actually do the work feel? What's your own perspective of it?
At the end of the day, the essence of healthcare, it's for patients to get for doctors to get accurate diagnosis, to treat the patients, because at the end of the day, what puts a smile on a doctor's face is seeing his patient or her patient going back home.
Yes.
Yes, when I say going back home, going back uh not as the way they came. Yes, and so whichever way that technology has it, as far as it's for the same cause, I feel that it's okay.
Yeah.
The only cry that we have is that, okay, it's coming to take our jobs and all of that, and that's why I still insist that for you not to be deprived of your job, you should place yourself in a way that when that wave of technology comes, you won't be caught wanting.
Okay.
Yes, but then there is telemedicine, there's nanomedicine, that's AI. Yes, that's AI. That digital health doctors.
Yes.
So they are placing themselves already in that situation that I'm talking about.
Okay.
And so AI does not work on its own.
That's true.
It is still humans that control AI.
Yeah, that put in that data.
Yes, they put in the data, they in fact everything. And so at some point, even though AI is coming into health, but I think that it is still the healthcare providers. I don't think technicians or engineers will come to manipulate machines in the hospital because it's AI, right? But I think that doctors too are into the innovation process as well, and so no one is left behind as far as you place yourself for the change. So
Okay.
I really don't see a problem with that as far as we are all for the same cause.
Yeah.
Because AI will never replace human intelligence. It will never be.
Okay, I see,
No.
I see, I see. It's actually something of very true. And I love the way you're also emphasizing about we adapting to the change.
Yeah,
Yeah,
adaptability.
that's true, that's true.
Yeah.
And what I want now is that you to speak directly to the girls that watching to this. That also want to like follow you because you have shared a lot of stuff that I'm sure that will be inspired by you. That I want to be like you, I want to be like confident. So What is, let me say, can you give one phrase that I can give to these females looking at you today that can help them, inspire them, or let me say, even motivate them towards this direction of medicine and MLS?
Okay. I would like to think out of the box.
Mm,
Yeah. It's not just about medicine. It's not just about ML. It's not just about the health field.
mm-hmm,
Yeah. There is also this field that it's people think it's for the boys. For example, engineering. You go to engineering, you see departments like mechanical engineering, electrical engineering.
mm-hmm.
You mostly see guys, you see boys in that department.
Yeah.
And so it's just kind of like, I don't know, it's kind of a stereotype kind of mindset.
Mm-hmm.
And so I'm not just speaking to medical doctors or aspiring medical doctors or
Mm.
healthcare professionals and all of that. It's
Yes.
to everybody that is watching me actually.
Mm-hmm.
So what I will leave to my audience, those that are watching, is that you can become anything and everything as far as you set your heart to it.
Okay.
You can be a doctor, you can be an engineer, you
Mm.
can be, even if it's a herbalist,
Mm.
well, that's an aside. You
Okay, it can
can be
become anything.
anything and everything as far as you say. It can be negative.
Yeah.
Yes, I'm not here to motivate. It can be negative, it can be
Yeah.
positive.
As far
It's
as you said
just
you had
it's,
to.
as far as you said, if you set yourself that, okay, I want to be wayward.
Yeah.
Normally, you see, right?
Okay.
And so then we are always striving, or we are always headed to the positive direction. And so you can become that dream person you actually are dreaming for
Yes.
if you work hard, if you put your heart into what you're actually into, and you see that you actually you become the change you actually seek or you're actually wishing to see.
Wow.
Yeah.
Very nice. Very nice.
Yeah.
Now I'll just ask you our final question. Since this
Okay.
podcast is called the Vision to Success. So for each person that comes to the podcast, we also like to know what is their own vision for Africa.
Okay.
So what's your own vision for Africa?
I'll start from my village.
Mm-hmm. Okay.
Charity begins at home.
That's true.
Yeah. So my vision,
Mm.
before I even started community health services and engagement and all of that, I want to see a community whereby, um, because I grew up in a home where we actually girls, and so at some point it became something else. It was like it was a taboo,
Mm.
us being born and all of that. But
Mm.
then we had to realize we had to keep our heads straight, so
Mm.
that we should make a point, because we have gone past the days where they say the girl child's place is in the kitchen, the girl's child's place in whatever. And so I envision, or I want to see a community whereby girl children, like there is this statement, the girl in the boardroom. You'll be able to see girls in the boardroom, girls on conversation tables, girls that are into shaping lives. I mean, anywhere, everywhere. And so girls are not left out, boys themselves are not left out, because I'm not a feminist.
Okay.
Yeah,
Mm-hmm.
it's kind of a wave, it's a ripple kind of something.
Mm-hmm.
And so if I can be a change, I believe that someone else beside me should actually tap into that.
Okay.
And so while I'm changing, while I'm going ahead, I want that somebody besides me, behind me, should also catch the vision and then run with it. And
Okay.
so, like, that's why I said it starts from my village, it goes to my country, and then Africa. So I wish to see that everybody thrives in whatever they are doing,
Okay. Nice.
even if it's in the health field, it's an engineering field, it's agriculture, wheresoever. But then it should be something that you're doing excellently and you're good at doing.
Okay.
Yeah. So that's what I see.
Okay.
Yeah.
Everybody thriving in their own field.
Everybody thriving
That's
in
actually
whatever
something
they're
of
doing.
confidence.
Yeah.
Yeah. Okay. Confidence. Thank you. Thank you for coming to the podcast, sharing your thoughts with us, inspiring me, inspiring our massive audience, and yeah, thanks once more.
It's my pleasure.
Yeah.
Thank you.